Hello, class, and welcome to my presentation on pertussis versus tuberculosis. And I will go ahead and get through these slides. So the first slide is going to be just a couple comparisons that both pertussis and tuberculosis affect the respiratory system. Both are infectious and both are also spread by droplet air mode of transportation, and both are treatable. And now to get into, first I'm going to go over pertussis. The scientific name would be Bordetella pertussis, which is also known as whooping cough. Anybody that has children may be familiar with whooping cough and how dangerous it is for our infants that are not yet immunized to it. It is an acute respiratory infection of the respiratory system, and the reservoir for pertussis is humans. So only humans carry that pertussis. It can't be spread from animals or water or anything. It is easily spread by droplet, and we can spread it when we're talking, not covering our mouth while coughing, if we're not covering while sneezing. And it can be treated with antibiotics. So that's just a quick recap of pertussis. The virulence factors, sorry if I mispronounced that, would be adhesions and toxins. Some of those toxins would be the pertussis toxic, which inhibits that G protein coupling and causes the phagocytes to convert too much ATP to our cyclic AMP, and so those adhesions that I have up there on the top, they do allow for the bacterium to bind to the ciliated epithelial cells in the upper respiratory tract. And the toxins are going to enable the colonization by interfering with the host clearance mechanism. So that's our mechanism of how to clear those out of there. Our signs and symptoms to look for, they're caused again by that bacteria Bordetella pertussis. It does begin usually as a common cold, and symptoms would be anything from runny nose, a low-grade fever, having a cough, and then it would slowly progress or rapidly progress to more of a violent coughing. On your inhale, oftentimes we'll hear that whooping sound, having some struggling to breathe. It can also lead, in the extreme cases, to like a fractured rib from so much coughing, those hernias, or sometimes in your eyes you'll see the broken blood vessels in the whites of the eye. The mode of transmission would be, again, air droplet, and it is only carried by humans. Diagnosis for pertussis would be throat swab. Your history, signs and symptoms. Normally when the nurses go over those indications, then they'll go ahead and the doctor will go ahead and order those lab tests to do a mucus sample, which is swabbing the back of the throat. And treatments would be the antibiotics. They'd be given to anybody who would be exposed to whooping cough. We can also prevent pertussis by having good coughing etiquette, good sneezing etiquette, and washing our hands. Again, the prevention for that would be cover up. We're going to make sure that we get immunized. The DTaP, which is given to the infants at 2, 4, 6 months, and then again at the 15 to 18-month mark, and the 4 to 6 years. Tdap is given to our preteens when they're around 11, 12, and also when you're pregnant, you will also get a DTaP immunization. And our populations that are more at risk would be, again, the unvaccinated infants are at the highest risk, but also people who live in countries where they don't have as much access to vaccinations. So here I attached a chart that shows the global trends of pertussis. And then we'll get into tuberculosis, and I'm going to just start with my fun fact here. I am a carrier of latent tuberculosis. Didn't find out until 2023 when I applied for nursing, but due to my other schooling, I had a negative test in 2016. So somewhere between 2016 and 2023, I was exposed, and it is latent, so I don't have any symptoms, and it is not spreadable. And so here, my scientific name for tuberculosis, Microbacterium tuberculosis. It is an acute disease of the respiratory system. Again, our reservoir is humans, and it is also spread by droplet air. And we can have an active or latent. In the active form, that's when it is contagious, and in the latent form, if it's untreated, we have a 1 in 10 chance of that person developing active tuberculosis in their lifetime. This one, the virulence factors, is very scientific things that had a lot of very big words. So basically, the broad breakdown of them would be the secretion factors, our cell surface components, enzymes that are involved in that metabolism, and the transcriptional regulators. Our signs and symptoms would be in the active, because speaking from personal experience, I would have never known that I had latent tuberculosis. It's not spreadable to others, and the patient may not show any symptoms. Without treatment, though, that latent tuberculosis can turn into active tuberculosis at any time. And so active tuberculosis does have some more severe symptoms that come with it. It does attack the immune system as well as that respiratory. And the patient is going to show signs of persistent cough, chest pain. They may start coughing up blood, having weakness, fatigue, some extreme weight loss. And our mode of transmission there, again, is by air and droplet, and it is only in humans, or mostly in humans. The diagnosis and treatment would be the diagnosis, you can get blood work done. That is how I found out about it. And then there's also the intradermal injection for the tuberculin between the layers of your skin on your forearm. So some of you may have had the little bubble test that they put on your arm, and that bubble will usually go away. In a positive case, it will not go away. Results can be read for that 48 to 72 hours later. And if your blood work or skin test comes back positive, then you do have to, for the rest of your life, be checked via chest x-ray or sputum test. It's often easier just to go get that chest x-ray done. The treatment for active tuberculosis and inactive tuberculosis would be antibiotics. It's a pretty extreme round of antibiotics. And the difference is that in latent tuberculosis, it would only be about 3 to 6 months of the antibiotics, and in active, it's longer. It would be about 4 to 9 months. And in, All right, well, we're just going to keep moving forward. So in the countries or in the populations that have the highest rate of tuberculosis or reported cases. In the U.S., it was 90.1% of the cases were in our racial or ethnic minority groups, and the Hispanic Latinos were in the highest rates of 36.8. Non-Hispanic Asians were at 30%, and then the non-Hispanic, Black, or African American were at 17.6. Also, our homeless population is at a higher risk, as well as those with the underlying health conditions are at a higher risk. This is a 2022 chart that I found that shows those higher rates in the world, and we can see here that in 2022 the highest rates were in India, had the most reported cases of tuberculosis. And then that's just my references, and thank you, but I know that there was a part that I missed. I think it may have just been, again, about that mode of transmission is droplet airborne. It's spread by person, and those most at risk would be those with those underlying health conditions. And that is it. Thank you for watching my presentation.